Good afternoon. Thank you all for joining us again today. Kevin Dick, I'm the District Health Officer for the Washoe County Health District. I wanted to provide some updates for you with new developments in regard to COVID-19. Have some. We did hear back from CDC. They confirmed that our first presumptive positive case, 50-year-old male in his 50s that was off of the Grand Princess cruise ship, that individual is confirmed positive. We had that presumptive positive test from the state lab, so this is what we expected. The state lab, as I've mentioned, had worked with CDC as they first got the test to ensure that they're performing it properly, so we've got that confirmed positive case. We're still waiting from CDC for confirmation on the second presumptive positive case. So that test was submitted on Friday. We got the news late yesterday, so that's looking. People have been asking how long it's going to take. Based on that experience, we're running about 4 days right now with getting that back from the CDC. We have no additional presumptive positive cases at this point. I can provide an update in regards to the Grand Princess cruise ship, the one that's been awaiting passengers to be deboarded down in the San Francisco Bay Area. The governor has been working with the federal authorities in regard to the Nevada residents that have been on that cruise ship, and the governor's office recently released a press release on that, so I can provide you some information about that. But I can tell you that the governor's office has continued to work closely with the local health authorities throughout, and so they involved us in their discussions with the federal authorities regarding those passengers and how they were approaching what they wanted to do with having those passengers return to Nevada. So the decision has been made that those 49 passengers are going to be returning to Nevada and will be isolated in quarantine for 14 days after they arrive here. So all of these passengers are asymptomatic, so they don't have any symptoms. They will agree to be tested for COVID-19 as part of their requirement. They'll be tested before they come back here, and they will also be agreeing to the self-isolation period for those 14 days after they return. There'll be a flight that is arriving in northern Nevada and a flight that will arrive in southern Nevada to return those travelers. And we've been working the health authorities in throughout the state that are involved in this with making arrangements to be able to have those individuals transported back to their residences where they'll begin that 14-day period of self-isolation. So I would also comment on this is the same sort of approach that we have also used with people that have been traveling back to the United States from China, outside of the Hubei province area, from travelers that have been returning from Italy and Iran, Japan, and South Korea. So the passengers on the cruise ship were in a location that we are aware of that had COVID cases and COVID transmission that was occurring, similar to these other countries that we've had people returning from. And so it's a consistent approach with these people being isolated for that 14-day period, and we will, during that time, be in contact with them. They will be self-monitoring. When they get off the plane, we'll do a screening and check for temperatures and that sort of stuff. They'll actually have a thermometer provided to them as well as part of their return, so that everybody has a thermometer to self-monitor and report back to the health district throughout that 14-day period on their condition. If any of them develop symptoms during that time frame, we'll be alerted to that immediately, and then we can take appropriate action to confirm whether it's potentially a COVID-19 case, or as we know, repeated to you, it's flu season. So we've got influenza A in particular going around, and other viral diseases, so we can screen them to find out what the reason for those symptoms are if they occur. We believe that the approach will help to ensure their safety in their close contact with us as we monitor them during this period, as well as protect the health and safety of the residents in our community. I wanted to also comment on the need for us all to keep what's happening in our community in perspective. We have two cases of COVID-19 that we've identified so far in our entire population. And so the risk remains extremely low of transmission of COVID-19 in our community. And we had an incident that occurred yesterday with a warehouse facility that Patagonia has, in which unfounded and irresponsible rumors were circulated about COVID-19 case and potential exposure there, that resulted in that warehouse notifying their employees that they were closing down, and got some media coverage. This resulted in our epidemiology staff, who are already very busy working on this response, having to redirect their energy to track down that this was indeed a rumor, and that there was no substantiation to the story that was being spread. So it required us to devote our already thin resources to be tracking that down, and it unnecessarily alarmed our community. And so I think it's really important that everybody in the community keep this in perspective. It's something that we should be concerned about, and we should be taking appropriate precautionary measures and appropriate measures to prepare. But it's important that we approach this in a calm way, that we not panic about what's going on. And we've done our best to be transparent here at the Health District. We've provided these briefings on a daily basis. We provide notification as we have additional information. And so I'd ask our community to rely on us at the Health District to inform about what is going on in relation to the COVID-19. And please try to don't be spreading rumors about what's going on, and please come back to the Health District to confirm if you're trying to identify whether a story is real or not. And for people in the community, please rely on the information that we're providing to you, because we're doing our best job to provide you with the real situation that we're experiencing. So with that, I'd open it up for any questions.
And one housekeeping thing, guys, just try and speak up your questions so the users who are watching online can hear your question.
Of the 49 Grand Princess passengers that are from Northern Nevada, we know some are from Carson City and Douglas County. Do you know how many are from the Reno-Sparks area?
So the question is, how many of the returning passengers are from the Reno-Sparks area? And we're not going to divulge that information. The governor's office has put out that we have 49 passengers returning from the state. So we have a portion of those that are coming here to Northern Nevada, a portion to Southern Nevada, and we've agreed with the governor's office to the coordinated communication on that.
So they're coming into the Reno airport, or they're coming, the state's release says that they're coming into a non-public area.
Mm-hmm. I can only confirm at this point that they're coming into Northern Nevada, Northern Nevada Airport. I can't confirm for you that it's going to be the Reno Tahoe Airport. We don't have information yet about when the plane will arrive and where the exact location is going to be.
And then it says that the local authorities are responsible for transporting these folks to their homes. Is that right?
That's correct.
Okay.
Yeah, we have a plan in place to be able to meet the plane where it arrives, and as I mentioned, we'll be conducting the screening of the passengers. We'll be providing them with thermometers and some resources, making sure they understand all of their obligations for their 14-day period and reporting back to the health district. Then we will transport them and their baggage back to their residence where they will self-isolate. And then we have plans in place for how we'll appropriately disinfect the vehicles that we're using for that. And of course, we'll have our personnel with appropriate protective equipment as a precautionary measure during the transport.
Can you tell me what we're getting questions, what is the 14-day self-isolation period based on? Why isn't it 21 or 30?
So the 14-day isolation period is based on our understanding of the incubation period for COVID-19. And so after the 14 days, if they haven't developed symptoms and they're through that incubation period, what we're really doing is, because these are people that don't have COVID-19, and it's a precautionary measure that they're being quarantined to determine whether from their exposure they actually developed the disease. So if they don't have symptoms within that 14-day period, then they're past the incubation period and it's safe for them to be out in the community once again.
If they don't pass the 14 days, say they show up with a temperature and a cough on day 13, then you guys go longer, correct?
Yeah, then we would be assessing them for what's the cause of those symptoms, and if it's COVID-19, then they would remain in isolation until they recovered from the disease. And then the protocol at that point would be that they pass 2 COVID-19 tests as negative. So we would collect the sample for testing. They would need to test negative. Then we would need to wait an additional 24 hours, collect another set of samples and analyze those. And with negative results, at that point, that would be the clearance for them to be released if they had come down with COVID-19.
I have another question. So I have somebody that emailed me and said, what kind of, you say, okay, you're asymptomatic, go in self-isolation for 14 days. Is there also information about, do you have people around you that could bring you food, or what do you do with your mail? You know what I mean? Some basic things. People think, if I'm isolated for 14 days, could I survive? I'm assuming, is there a checklist or something you guys give these people?
Yeah, we've been planning for this, and particularly with the returning passengers, because as you might predict, if you're like me and go on a trip for a few weeks, you usually try to clean out your fridge a little bit before you head out and those types of things. So we will be working with returning passengers on their preparation for being able to resupply. We have a number of grocers that now have their electronic shopping capabilities that can help with food. We have pharmacies that can provide for deliveries, and then we also are looking to engage some of our volunteer partners through the Medical Reserve Corps and CERT to help with deliveries, that sort of stuff for these people that are isolating in their residence.
How do you enforce this? How do you enforce, please self-isolate for 14 days?
Is there a penalty for it?
So there are criminal violations if people are violating the agreement that they make with the state, and so that's what we're relying on. We have some ideas about some surveillance that might be conducted, and we're not going to be able to be there 24/7.
Sure.
But we have some ideas about ways that we can help to reinforce the need for people to.
So the Carson district yesterday put out a notice about people coming back that the state subsequently said, no, that's inaccurate. they're not authorized. The state is also saying that they're not getting information from the feds. So, and the state's health district website has numbers from last week. So the information's coming in a lot of a delayed fashion. Are you guys getting the information you need from the state? And is there any kind of, I mean, you've been referring us to the state for a lot of details that they don't seem to have. So can you give us some explanation of what's going on with that?
So the state, my understanding is that the information on our persons that are under monitoring, those statistics, that we report those to them. Today is Tuesday, I believe, so we report those to them today, and then they'll update their website after they get that information from all of the health authorities reporting that data to them. So I think it's a weekly update that they're providing on their site. We are getting information that we need from the state, and I think that the issue that occurred with the communication yesterday that was premature was that it was based on an understanding of the direction that the governor was taking in communications with the federal authorities, but the agreement with the federal authorities on what we wanted to have in place in order to have the state accept these passengers back had not been finalized. And so there is a lot of information and a fast-paced flow of communication. And so I appreciate that the governor's office has done such a good job of involving us and in that communication. But that can result with the fast pace that occurs that something happens like that's a misunderstanding. But I guess I would say that the information that was provided ended up being consistent, I believe, with where we ended up. And so I think it's better that we're communicating, and there's a risk of information being disclosed prematurely than that we don't have that communication with the governor's office.
With that information coming out, are there any of those residents in Washoe County, or are they in neighboring counties that they reside in?
So we will be having passengers arriving back here in northern Nevada, and we have from that residents of Washoe County, and we also have residents of other northern Nevada counties that are all coming back in that same plane. And so their health authority will be involved in greeting those passengers and providing transportation for those passengers back to their residences, the ones that are outside of Washoe County.
And just so we can keep up with that, how many do we have in Washoe County?
As I said, we're not going to provide that number. We're keeping our communications consistent with what the state of Nevada through the governor's office is communicating.
How many tests does Nevada currently have, and what's the status of additional tests that were supposed to be coming from the CDC?
I can't give you a precise number on the number of tests that we have, but I can tell you that we have adequate capacity currently, and as I've explained several times, I wanted to say I think we have an excellent state lab, and they've done a good job in how they've approached this, and early on identified a strategy and a path forward for how to resupply with the reagents that they need to continue to run the test. So we have our lab's in a sustainable position with the resupply to continue to be providing the tests, but I have not heard that we are receiving the additional kits that would increase our supply that CDC has been producing and beginning to distribute.
Of the 49 people that came back here that are asymptomatic, are there any Nevadans that are being left behind in California because they have symptoms?
The information that I have is that all of the Nevada passengers on the ship are those 49 people, and they are all asymptomatic.
And in terms of, this is another question, because the president said anybody that wants to be tested can be tested. And since there are a finite number of tests, do they have to be high risk? Was in the area, China, Italy, on on the cruise ship, is that when those tests are delivered? You can't just come in to your doctor's office and say, I want to be tested. Is that correct?
That's correct, Terry. There has been messaging that everybody can be tested if they want to be tested. And that's not the reality of the situation that we're in. But we do have adequate testing available for the people that we feel are the high priorities, the people that most likely would be, might have the COVID-19 if in our community. So we are doing a risk assessment. It does have to do with travel history, if they had the potential of contact with somebody that had COVID-19. We're still providing assessments for who are the appropriate people to use that testing capacity for. I guess I would tie to that it also is triggered by the condition that people are in. If people are hospitalized and have more acute medical needs, that also plays into the risk assessment protocol.
What does a mild case look like?
A mild case might look like a sniffle. We know that there's that most of the people that get COVID-19 will have mild symptoms, but that there are about 20% of the cases that have more severe symptoms that develop. So there's a range in how severe people's symptoms are when they get the disease.
And what might somebody be worried about if they were to get it and say, oh, maybe it's just a mild case? What would be the distinction between, say, a mild and a severe?
So we are looking at fever and people having a cough, shortness of breath, respiratory symptoms. And we're also looking at it seems that we've had some cases in Nevada that traveled here where they had nausea associated as well. So those are some of the symptoms that we're looking for.
Is there any reason to feel perhaps that things are subsiding at this point, or is it still too early to say?
Well, I think many of you probably heard in the news that it appears that in China, the number of cases are subsiding. So that's good news. But also, we're not at the same place here in the United States with the COVID-19 outbreak as China is. So they had a lot of transmission and spread earlier on, and they took a lot of action in response to that. And we've seen what's been occurring in Italy as well with the spread there. So I think it's premature to look at China and say that the situation is over and we don't need to worry about things here. It's certainly encouraging to see that news out of China, but I think we need to remain vigilant in our efforts to try to prevent our susceptibility to and the spread of influenza-like illness in our community. As I've repeated, you're probably getting tired of hearing me say it, but it's really the most important thing that everybody can do is wash your hands, cough in your sleeve, stay home if you're not well. Take those precautionary measures that can help prevent the spread of flu and viral infections in our community. That will protect us from COVID-19 as well, and it will also prevent people from developing symptoms that aren't COVID-19, but then create a concern that it might be because they're similar symptoms that people develop when they have their influenza-like illness or other viral respiratory diseases.
Would you say don't be surprised if you go looking for something, you're going to find it in terms of health, right? You keep testing more people, you're going to find what you're looking for. So I guess, would you be surprised, or residents shouldn't be surprised if the numbers of positive, not necessarily confirmed, but the numbers go up? Because again, you've got more kits, they're out there, people are getting tested. Again, if you look for it, you will find it.
So at this point, I would not be surprised if we had additional cases that occurred in our community. We don't know if that will occur or not. We're still very low with 2 cases. So again, it's not something that people are facing a high risk of transmission and having COVID-19 in our community. But knowing that we have other communities that have had additional cases and some communities that have many more than ours, I wouldn't be surprised if we did detect additional COVID-19 cases.
If people stay home, say they think they might have something, how long should they expect to stay home for?
I'm sorry.
So if people think that they have like a mild case or that they're just worried, how long should they maybe stay home for?
So if they have symptoms, then we're asking them to contact us at our 328-2427 number to talk with them and to identify if there are travel history or other factors that would indicate to us that there's potentially a higher risk that they may be in a situation where they may have contracted COVID-19. But as far as if people have symptoms and they're not elevated through our risk assessment protocol, then I would suggest that after they recover at home and are free from fever for 24 hours, if it's a viral infection or something like that, then that would be a time that they should consider going back to work.
A Nevada assemblyman called the response and the fear around coronavirus as irrational. Is that an accurate description of what's been going on?
I think it's understandable that people have fear of something like this that we haven't seen in our lifetime, and it's compounded when you see the news and cities shutting down in other countries, and you see things with like what happened with the stock market the other day. Those are all things that affect us when we see that going on, and it does cause people to become fearful. But I don't think it's something that we should be fearful of right now. I think we should remain, as I said, calm and utilize the knowledge that we have and our understanding of this disease and how it spreads to take the precautions to avoid the spread of the disease, avoid getting it ourselves by taking those precautionary measures. And take the time now also to, if you're in a business environment, to work on how can you best sustain your business if people do become ill and they can't come to work or they do have to be quarantined. How can they telecommute? What are your plans if Joe and Sally are out next week? Who's going to cover those types of things? Now is a good time to be working on those plans.
Several counties in California, including one that borders us, announced they're no longer going to be quarantining people that come in contact with COVID-19 patients or suspected cases. Are we getting any closer to doing that here?
We're not there at this point. We'll continue to be diligent to attempt to control the spread of disease. If we are aware of a COVID case, then currently our plans are to work to respond to that and try to prevent any spread in the community.
What's the next step for this man in his 50s? Is anything changing because it's officially confirmed?
No. So we took the initial positive, our presumptive positive, and took all actions with the presumption that was going to be confirmed by CDC. So nothing changes with the way that we're dealing with that person, and they remain isolated at home, and I wish them a speedy recovery.
About what's the recovery time expected for COVID-19?
I don't have that information to be able to provide you, and I think it's going to vary case by case.
Any other questions?
Thank you.
Thank you very much.
Thanks, guys.